page number 206, those who have the textbook, diet therapy. If anyone is joining late, please help them out with the page numbers. Yeah, new book, page number 206. So diet therapy, what does it mean? Just to modify your normal diet, okay, so that it can meet the requirements of anyone who is sick, okay. Even it could be some acute illness, short-term illness, or some chronic illness, okay. You may be prescribed certain diet, okay, normal diet, balanced diet, but with some additions or some subtractions, okay, or along with some supplements, okay. So something that could accelerate how your clinical management can function, okay. It's not a remedy. Just by following diet therapy, it's not a remedy. You're not supposed, it does not claim to cure any of your diseases, okay. So it makes the medical or surgical treatment more effective. That is the main conclusion of diet therapy. There is a treatment going on. You may be on medications, or you may have just done your surgery, or you're preparing for your surgery. Some dietary recommendations were prescribed to you by a consultant, okay. And when you follow these guidelines prescribed by a consultant, it means you are undergoing a diet therapy, okay. So what are the purposes of diet therapy? Why it is used? To maintain the proper nutritional status, okay? Maybe before, for example, if any woman is trying to conceive or is planning to conceive, she has to correct her nutritional deficiencies first for a very easy, a healthy labor and pregnancy, okay? So to make sure your nutritional status is fulfilled for the purpose of whatever treatment you are undergoing, okay. Energy requirements of the patients who are having disease conditions, but at still they have a basal energy requirements that everyone has to meet, okay, less than or more than. So to meet that energy requirements, diet therapy should be followed. To correct any deficiencies, as mentioned earlier, to afford rest. So the diet therapy food usually focuses on, it is not supposed to aggravate any of your existing clinical conditions. Okay. The diet therapy is supposed to stabilize your body. It is not supposed to cause more inflammation into your body. Okay. And also metabolic activity to maintain the body's ability to metabolize nutrients, macros and micros. Changes in body weight, those who are aiming to gain weight, lose weight, okay. So they also follow certain diet therapy. Like people say, I'm on a diet, ketogenic diet or a calorie deficient diet, okay. That also comes under diet therapy. So glycemic index. What do you mean by glycemic index? Every food, whatever you eat, they are not absorbed or digested in the same manner, okay. Food that you eat is not absorbed or digested in the same manner. Some food, we say it increases the sugar level in your in your blood. It means that food has high glycemic index. Some food, we say it's good for diabetic people. Okay, whichever food is termed as good for diabetic people, it means it naturally is very low in glycemic index. So what is glycemic index? Glycemic index is the rate at which a particular food is causing glucose spike soon after you eat it. Okay. the highest the glucose spike a particular food gives you, the more is the glycemic index. For example, sugar. Okay, sugar will give you an absolute high peak of a glucose spike as soon as you eat it, and it falls down abruptly. You can see here, if you see the graph here, if you can understand the graph here, this is the time when you are ingesting a food, and immediately within few minutes your blood glucose levels are reaching the peak. Okay, and it is falling down sooner than later. And if it is falling down sooner than later, okay, you can see here it's reaching a peak and it is falling down soon. Okay, so this is a high glycemic index food. Okay, then you have a medium glycemic index. It will still increase your blood glucose level, but on a very slower rate as compared to the high glycemic index food. Okay, and low glycemic index food are ideal because they don't spike your blood glucose levels. Okay, so the body does not go into a stage of inflammatory shock. Okay, and there is a formula to calculate glycemic index. This is done in laboratories and all. Okay, just you have to understand the formula of glycemic index. It means, see, there is a reference food. Reference food, usually they take, any laboratories, they will take either sugar or a slice of white bread. Okay, either white bread or sugar or plain glucose. These could be the reference food. Okay, so 50 gram of reference fruit, how does it increase the blood glucose level? That is in the denominator. And 50 gram of your test food. For example, you want to test pasta. Okay, how does pasta increase the blood glucose? Or rice, or red rice, wheat, ragi, millet, okay, and, dals, legumes, pulses. Anything could be a test food. You're just testing it. One piece of food, you're testing it, eggs or anything. Okay, so that test food, how it is causing the glucose spike in your blood, the rate at which the test food is causing glucose spike in your blood will be on the numerator. Okay, and this entire thing multiplied by 100. So this is the glycemic index formula. Okay. So usually we keep a 2 hours gap. Okay. You have a reference food. Usually we know the reference food, how how high it can cause the blood spike. Okay. After 2 hours of eating it. Okay. Just now you are having some 50 gram of sugar or 50 gram of plain white bread. Okay. After 2 hours, under 2 hours, every half an hour, your blood will be tested. So to see how is the glucose spike going on. Okay, for the next 2 hours, we'll check and we'll get the incremental blood glucose. The same formula, the same thing you have to do with the CHO, means carbohydrate. CHO stands for carbohydrate. Okay. Glycemic index is not for protein. Glycemic index is not for lipids. It is for carbohydrates only. Okay. So 2 hours is the time gap that we give to see how the test food and the reference food is acting on your blood. It is not given in the same time. Maybe today reference food test is done, tomorrow test would be done. Okay, not at the same time. So is it clear what is glycemic index? How is it calculated? In textbook, it is given CHO, means carbohydrate. CHO is a short form of carbohydrate. So these kind of test is usually done in clinical settings. Okay. Nutritional laboratories and clinical settings, they will use this formula, but you don't have to use this formula, because if you find the glycemics, just type glycemic index of rice, glycemic index of wheat, glycemic index of wheat pasta. Okay, just type anything in Google. It's already available. List of glycemic index of Indian food cuisine. Okay, all the legumes, dals, okay, the lentils, pulses, legumes, millets, cereals, everything usually used in the Indian cuisine, along with its glycemic index, you will get it in a chart form. Okay. Is it clear to all? What is glycemic index? Is the concept of glycemic index clear? And remember, we are not checking the calories here. We are not checking the calories. Okay. We are only checking how 50 gram of any food, okay, any given food, 50 gram of that, just 50 gram of any given food, any given specific food, test food, how is it making your blood glucose level act? Okay. How a specific type of food, how is it making your blood glucose level act? That's the only thing we are checking in glycemic index. Is it clear to all? Next, factors affecting glycemic response to food. Like what all are factors that can either increase the glycemic index or decrease the glycemic index? How it can reduce or increase the blood spike in your body? Okay, so glucose spike in your blood. First is rate of ingestion, which means, let's say, if I give you a juice, okay, a juice of 3 apples, okay, and I give you the next day 3 apples to eat, juice of 3 apple and 3 apples to eat. After ingesting what will immediately you will get a high glucose spike? Is it the juice or is it the apple? Am I audible to all? Am I audible to all? Okay. Imagine I give you a glass of juice. Okay, apples. I have made a juice of it, and the second option is 3 apples to eat. Okay, as it is. Which do you think will cause high glucose spike? Juice. Why? The rate of ingestion of juice is high. Okay, you will finish a glass of juice within 1 minute. Okay, but if you but if you're eating 3 apples, okay, it will take you much longer to chew, to swallow. Okay, that is the reason. That is what we call as the rate of ingestion. Okay, rate of ingestion means how quickly you are ingesting, swallowing, eating up any given food or liquid or fluid. Okay, how fast you do it, the higher will be the glucose spike. That's the reason we say you should eat slowly. Okay, when you eat slowly, when you chew slowly, when you swallow slowly, okay, the food will reach your gut in a very slower pace. Okay, so the glucose spike will also be very proportional, okay, at a very slow pace. Okay, the more fast you eat or gulp down any given food, okay, with all its calories, faster will be the glucose spike. Is it clear? Is it clear to all? This is the rate of ingestion. This is the one factor that affects the glycemic response. Okay. Next is food components. Okay. So when you have fat and protein mixed in your meal or whatever food you eat, okay, glucose spike will be reduced. For example, if I give you plain bread to eat, plain bread, plain white bread to eat, and the second option is plain white bread along with eggs, okay, along with eggs, omelette or boiled egg, anything. Okay, you're consuming this together. Okay, in which situation will be the glucose spike high? When you are having just the plain bread, okay, because the protein and fat content is not there much. Okay, in the second option, there is additional protein and fat content that comes from eggs. Okay, so adding protein and fat into whatever carbohydrate you are having, the glucose spike will be at a reduced rate, uh, at a reduced rate. Okay, the glycemic response will be very slow. Okay, complex carbohydrates. Can you name few complex carbohydrates? Anyone? Examples of complex carbohydrates. All your millets, legumes, sprouts, yes, muesli, oats, whole grains, roots and tubers. Roots and tubers are also complex carbohydrates. Pasta, if it is al dente, okay, then it is complex carbohydrates. Why? Because complex carbohydrates have a longer and a bigger carbohydrate structure, which takes time to be broken down. Okay. So when any complex carbohydrate enters your gut, it takes time. Okay, it takes time for it takes time for your stomach acids. Al dente pasta. Okay, it means not completely cooked, not overcooked pasta. Pasta should have a certain bite to it. Okay, don't overcook the pasta. Okay, that is al dente pasta. When you're boiling the pasta, it should not be completely cooked and it should not be mushy. Okay, it should retain its structure. It should have that bite. Okay, so that is al dente pasta. So that's a complex carbohydrates because it takes time for your stomach acids, your enzymes to break it down. Okay, the more time the stomach acids and enzymes take to break down a food, slow will be the release of glucose from them, and slow will be the glucose spike in your blood. Okay, so that is how complex carbohydrate responds to your glycemic index. Then acidity. The more acidic a meal is, the lower will be the glycemic index. Okay. So before you eat your lunch or dinner, if you have 1 tablespoon of apple cider vinegar or even anything that is acidic, that has acetic acid, if you have any fermented vegetables, okay, pickled fermented vegetables have few pickled, not the Indian type of pickle. I'm not talking about that. That is too spicy. It has high sodium content, not that. Okay. When you pickle the vegetables or certain foods in vinegar, okay, having that pickled vegetables or just having uh, a teaspoon of apple cider vinegar mixed in lukewarm water, drinking that or anything that has acetic acid, okay, and drinking that 5 minutes before your meal, okay, it creates a very acidic environment in your stomach, and that will also proportionally reduce the glucose spike in your food, okay. So the more the acidic is the environment in your gut, lower will be the glucose spike of your meal. Whole wheat pasta is available, okay. Not just the maida pasta, whole wheat pasta is also available. It's a better and nutritious option. Next is methods of cooking and food processing. If you steam vegetables, okay, steamed vegetables and slightly sauteed vegetables, okay, sauteed and steamed vegetables will have a slow spike in glucose rate as compared to overly cooked and over processed vegetables, okay. So methods of cooking will also affect. See, starch is a carbohydrate. Regarding starch, regarding different type of starch, we will study in the chapter of carbohydrates. Okay. The paragraph given there has a lot of enzymes like amylose, amylopectin, that is. Am I audible now? Is my screen visible? On 208 page number, amylose, amylopectin. Okay, these are some enzymes on different found types of grains. Okay, so these enzymes will help in the hydrolysis of food. Hydrolysis means breakdown of the water molecules. Carbohydrates have water molecules. Okay, so if the hydrolysis rate is higher, okay, if quickly you are able to break down any starches, quickly it will be absorbed, quickly the glucose spike will also will be there, okay. So naturally any grains that have higher concentration of amylose or amylopectin, any grains that has a higher rate of amylose or amylopectin, it will increase the glucose spike, okay. Excuse me. Yeah, that's all. Am I audible now? Yeah, barley, potato, maize. Maize is also considered as a grass grain. Okay. Maize means corn. Okay, corn, barley. Okay, these have high uh, amylose and amylopectin. Rice and wheat also. Next is rice and wheat. Polished rice and wheat. The new variety of wheat, there are high amylose wheat varieties as well. Gastric emptying means the food has has been done the hydrolysis in your stomach. Okay, and when the food leaves your stomach and it goes into the duodenum, okay, that process is called gastric emptying. So methods of cooking and food processing. So white rice has higher glycemic response as compared to brown rice, because when you polish the rice, okay, that is a food processing for polishing of the rice, that increases the glycemic index. Okay. Wheat, if it is eaten in the form of rotis, chapatis, that has lower glycemic index as compared to any other refined cereals. Okay. Multigrain atta has a better glycemic response. It is lower in glycemic value as compared to a single grain atta. The more the amount of protein and fiber is present in any of the cereal or pulses, better will be its glycemic index. Parboiled rice is better option as compared to white rice. Packet chapatis, we cannot be sure that it is only wheat chapati. It could be mixed with maida as well. Okay. Then the physiological effects. Digestion of dietary carbohydrates in the upper gastrointestinal tract provides glucose, fructose, and galactose, that is in the small intestine. And if there is a presence of non-absorbable oligosaccharides, that are different types of carbohydrates, okay, that different dietary fibers are, if it is present in the food, okay, that will also slow down the rate at which a food is broken down. Okay, so the more fiber that you have in your diet, lower will be the glycemic response. Okay, the less fiber you have in the diet, quickly the blood glucose spike will take place. Now, see, looking at the classification of glycemic index, it is classified into low glycemic index, medium, and high glycemic index. Okay, so this is whatever answer you get using that formula. Okay, whatever they have done, the test that they have done in laboratories and clinics. Okay, they have studied about glycemic index. Okay, so if the answer that they get in the glycemic index formula of a specific kind of food, if it is 55 or less, we call it low glycemic index food. Okay. Majority of the fruits, vegetables, okay, grainy bread, brown rice, fish, egg, they come under this category. Medium glycemic index food, it comes in the rate of 56 to 69. and whole wheat products, basmati rice, sweet potato, table sugar, white rice. Okay. High glycemic index of food if the score is 70 or higher than that. If you remember the formula of glycemic index, okay, these scores you get from that formula. Okay, whatever is the answer, based on that, you will classify the food into these three different categories. Okay, rice crisps, flakes, baked potatoes, white bread. If you straight take the glucose as it is, okay, glucose has a higher glycemic index as compared to table sugar. Okay, you can see here straight glucose, the glycemic index is 100. The glucose powder that you get, as it is, if you take, the glycemic index is 100, because immediately it will be absorbed from the stomach itself. The absorption will start. So classification of glycemic index, just read through that topic. A table is also given, glycemic index of different food. Okay, just go through that. That is kind of information for you, which you can include, which you can avoid for a diabetic menu plan. So glycemic index, is it clear to all, the concept of glycemic index? Because now we are going to a second topic of glycemic load. Is it clear to all? What do you mean by glycemic index? So next is glycemic load. So the difference between glycemic index and glycemic load. Glycemic index, you understand it as a ranking system. Okay, just take a glycemic index as a ranking system. Okay, we know the different type of food and what are their rank, what are the categories, okay, of different type of food. But for example, if I give person A, okay, if I give person A 2 slices of plain bread, okay, if I give a person A 2 slices of plain bread, and to a second person, I give uh, 5 to 6 slices of plain bread. Okay. Who will have the highest blood glucose response? Because plain bread, we know under which category. We just know the rank of the glycemic index of plain bread. Okay. But the calories, obviously, the second person will have the highest load. Okay. But just by knowing the glycemic index, that information is still half. Okay. How much amount of food a person is eating, that we are not looking in glycemic index. The quantity, okay, glycemic index does not take into consideration the quantity. It will only give you how your blood glucose level is responding to 50 gram of carbohydrates, not more than that. Because reference, if you remember the glycemic index formula, denominator of the reference food was 50 gram, numerator of your test food was 50 gram, not more than that. It was 50-50. Okay. But not everyone will have just 50 gram of that particular food in their meal, right? The quantity will be completely different. When you eat a meal, when you eat for an entire day, whatever you have eaten, okay, the quantity will be completely different. So glycemic index is not taking into account how much food you are eating. Okay, what is your entire meal made up of? Glycemic index is not taking account of that. But when you want the account of that, that's when you use glycemic load. Okay, glycemic load. For example, you can see the formula of glycemic load here. Carbohydrates in gram multiplied by whatever is the glycemic index. Okay, divided by 100. That is the glycemic load. Okay. So, for example, I'm giving you 2 chapatis, a small ball of rice. Okay, in a thali, I'm giving you chapatis, 2 ball of rice. Okay, dal, a potato sabzi. Okay, these things are in your plate. Okay, along with some protein. So the carbohydrate, it could be complete protein. So carbohydrates we cannot count from that. Okay, but dal has carbohydrates. Okay, whatever amount of carbohydrates in the dal is present in your plate, you have to add that. Rice has carbohydrates, you have to add that. Okay, wheat has carbohydrates, potato has carbohydrates. Okay, so add all these carbohydrates in grams multiplied by their glycemic index divided by 100. You get the glycemic load. Okay, is it clear? Is the formula clear? How glycemic load is calculated? So in glycemic index, while checking the formula, only 50 gram was used. But while eating the food, maybe you're having 120 grams or 200 grams of carbohydrates you're having in your meal. Okay. So 200 grams multiplied by, or if a chapati is giving you 200 grams of carbohydrates, 200 grams multiplied by glycemic index of wheat or chapati divided by 100, you will get the glycemic load. See the chapter of menu planning. See the chapter of menu planning, or just you can use Google as well. Okay. Carbohydrates present in one small chapati, or carbohydrates present in a bowl of white rice, a small bowl of white rice. You will get approximate carbohydrates. Meat, fish, eggs, cheese, butter, oil, water, plain coffee, plain tea without milk, okay, without sugar, without milk, okay, they are zero carbohydrate food. Non-starchy vegetables, nuts, seeds, okay, avocados, coconut, they are very low in net carbs. So this is the glycemic index category. I guess you remember 55 or less is low glycemic index. 56 to 69 is medium, and more than 70 or more than 70 is high glycemic index. Similarly, glycemic load also has a range, also has its category. Okay. If it is less than 10, using this formula, whatever answer you get for different food. Okay. Using this formula, if the answer is less than 10, it is low glycemic load. If it is between 11 and 19, it is medium. And if it is more than 20, it is high. Is it clear to all the difference between glycemic index and glycemic load? So here you can. So here you can see the difference between glycemic index and glycemic load. Glycemic index is kind of a ranking list. Okay. It will just rank different food according to the carbohydrate, how it causes blood glucose response in your body. Okay, based on that response, you are ranking different food items in a list. Okay. The quality of glucose that is tested here. Okay. But glycemic load, that can predict the quality and quantity both. Because in the formula of glycemic index itself, we are using in the formula of glycemic load, we are using glycemic index. So automatically the quality of glucose is involved, okay? But we are also using how much grams of carbohydrates you have consumed, okay? So quantity is also there, okay? So in glycemic load, quality and quantity, both specific answer you will get, okay? Next is dietary supplements. There are different forms of dietary supplements. They are the group of products that are intended to supplement your diet. They are not supposed to replace your diet. Okay, they're just supposed to supplement your diet. Usually vitamins, minerals, amino acids, any herbs with botanical value to it. Okay, combination of all this can also be a dietary supplements. It's usually used by people who are not taking enough food, as I mentioned, 1,500 kilocalories or less. That if that is your total target, you are most probably not meeting all your vitamin and mineral essential amino acids categories. So you will require dietary supplements to a certain degree. Okay. Pregnant women, lactating women, they definitely require iron supplements, folic acid supplements. Okay. Newborn babies, they will be given vitamin K injection at birth. As soon as a baby is born, vitamin K injection is given because they are not born with clotting factors. Okay. Vitamin K injection has to be given because it helps in blood clotting. Okay. Those who are addicted to alcohol, they are given vitamin B complex supplements. Okay. People who are recovering from surgery, burns, injury, vitamin C, anything that can accelerate the wound healing. Okay. Vegans will require vitamin B12, vitamin D, calcium supplements. People who are taking specific medications that will interfere the natural absorption of a specific nutrient. Okay. For example, TB patients. Okay. People who suffer from any chronic diseases, inflammatory bowel diseases. Okay. They have to take probiotics in their diet. People who are habitual dieters, people who have eating disorders, suffering from AIDS, okay, any medical conditions to prevent any diseases or incidents of diseases. So these are the different purposes in which dietary supplements are taken, okay. So it comes in different forms like herbal supplements like garlic, wheatgrass, alfalfa, ginseng extracts, aloe vera, spirulina, that's a algae, turmeric, okay? Taking the turmeric shots in the morning, these are herbal supplements, okay? Even in nutraceuticals, you get the supplementations of turmeric latte and spirulina, okay? The spirulina powders or some spirulina tablets, capsules are available, okay? Aloe vera juices are available as supplements. Ginseng extracts in various uh, mix of multiminerals and vitamin supplements, it's available. Then you have bodybuilding products, whey proteins in form of whey proteins, muscle building proteins, creatine supplements. Laxative supplements, those who suffer from constipation. Okay. Psyllium, that is isabgol. Psyllium, that isabgols. Wheat bran, weight loss products. Okay. Those come under laxative supplements because they are rich in fiber. Okay. Biologic and nutrient supplements like antioxidants, omega-3 fish oils, beta carotene supplements, antioxidants, glutathione, okay, vitamin C supplements. So is it clear to all about dietary supplements, different types of dietary supplements? 1 spoon of isabgol on a daily basis is completely fine, not more than that. If you are planning to take it for a long period of time, 1 spoon, 1 spoonful of isabgol mixed in plain water or mixed in any of the juices that you take, okay? Or you can make a jaljeera of isa and put 1 spoon of isabgol into that, and having that for a long period of time, it is completely fine. Don't overdo it. That would lead to other side effects. Wheatgrass and aloe vera juice, these are not required by everyone. Okay. Diet and inflammation, obesity and inactivity, sedentary lifestyle, physical inactivity is directly related to low grade systemic inflammation that for a long period of time, you will not be aware of it, even if you're overweight and obese. Okay, you don't have any clinical symptoms, but still, if your body is undergoing inflammation for a long period of time, and it may result in some chronic inflammatory diseases like arthritis, okay, carditis, pneumonitis, bronchitis, okay. So diet is directly related to inflammation. Poor diet, stress, okay, stress can also increase your cortisol levels and it can affect your immune system. Surgery, infection, burns, pain, these are also stressful conditions. Unhealthy gut means you are losing a lot of microbiomes, natural microbiomes from your gut. Okay. So having your healthy flora, gut microbiome is very important because that is very crucial. Your gut microbiome is very crucial in preventing early onset of any inflammatory diseases as well. Okay. How to correct it? Start eating more pickled vegetables, add more fermented food in your diet. Okay. Have more probiotic and prebiotic rich food in your diet. With that, you can rectify this. Obesity also causes low-grade systemic inflammatory response. Your immunity is also not regulated. You will have insulin resistance. Insulin resistance also leads to inflammation because the blood glucose level, the type of pickle I'm referring to is not the Indian pickle. Okay. You cut some carrots, radish, some onions, you put it in vinegar. Okay. Or you boil and cool down the hot water, add some vinegar, just boil water, let it cool down properly. Okay, add some vinegar into it, add salt into it, sugar into it, so these will act as preservatives. Add vegetables and some spices into it. Okay, and within 1 week your pickled vegetables will be ready. Okay. Any vinegar you can use. You can use a regular synthetic vinegar as well. You can use apple cider vinegar as well. Onion, garlic, these things can be used. Having amla juice on a daily basis is a good dose of vitamin C. Bananas are also rich in prebiotics. Apple cider vinegar you can take lifelong, but you should not overdo it. 1 to 2 teaspoons of apple cider vinegar on a daily basis is fine. Too much of baking soda is not advisable. Okay. 2 to 3 pinch of baking soda in your diet will not cause you any harm. Okay. Baking soda is a very essential component in your kitchen. In Indian pickle has high amount of sodium, okay, as compared to other pickled vegetables. Indian pickle as has it's not about the spice, it's about the sodium content. Okay, it's high in sodium. If your diet is naturally very low in sodium, having Indian pickle will not cause any harm. Okay, but if you already have a high sodium diet and you're adding Indian pickle into it as well, okay, it will increase the sodium content of your food and that could accelerate any hypertension that you have. One spoon of apple cider vinegar in a glass of water, in a glass of lukewarm water. Dilute it down, okay? Dilute down the apple cider vinegar with a glass of lukewarm water. Have this before lunch, 5 minutes before lunch. Okay, that will reduce your glycemic index. Sorry, it will reduce the glycemic response of the food. So insulin resistance in obesity, which means what? Your pancreas are secreting insulin, but your cells are not accepting insulin. Cells are not allowing an insulin to help the carbohydrates or glucose get into the cells. So what happens? Blood glucose levels will stay high. Too much of insulin will also be there in your blood. It will lead to inflammation, okay, chronic systemic inflammation, and that will lead to other kind of disorders, lifestyle based disorders. Okay. This is the anti-inflammatory food pyramid. If you don't have any gastric ulcer, if you do not have peptic ulcer, gastric ulcer, you can still have apple cider vinegar. Okay. So raw and cooked vegetables. Okay. It's an anti-inflammatory food. Fruits, usually the all the berries, okay, blueberry, strawberry, raspberries, all the berry family of fruits, okay, are anti-inflammatory. Whole grains, cracked grains, pasta al dente, as I mentioned, beans and legumes, healthy fats like olive oil, almond oil, walnut oil, hemp seeds, avocados, seafood, soy food, mushrooms, eggs, fish, poultry, lean meats. You will not find red meat here, okay? Healthy herbs, spices like turmeric, garlic, cinnamon, okay? Tea, oolong tea, green tea, white tea, okay? Supplements, coffee as well. Coffee, if you have it without sugar and without milk, it's a good source of antioxidant as well. Not overdo the coffee intake, a normal cup of coffee. Red wine. Red wine, we will not keep it in Indian diet because to counteract the calories that an alcohol can give, the amount of vegetables that should go, we do not have that amount of raw vegetables in Indian diet. Okay, you have a lot of vegetables available in market, but how you cook that on a daily meal plan, it's very low. Okay, usually the vegetables that we have in Indian cuisine also is like overcooked. Most of them is overcooked. So and very less Indian cuisines have raw vegetables as a staple. Okay. So it's better to not have alcohol at all. That is the best anti-inflammatory action you can take towards your health. Dark chocolate, plain dark chocolate, sparingly if you use it is good. Too much of caffeine can lead to gastric issues. Then you have prebiotics, probiotics, and symbiotics. Prebiotics are the food for bacteria, okay, like your bananas, garlic, anything that has lactose, okay, legumes, greens, berries, banana, honey, barley, flax seeds, oatmeal, okay. They all act as prebiotics because they act as food for the microorganisms that are all microbiome that you already have in your body. For them, prebiotics are the food for them. Okay. Probiotics. Probiotics are direct live bacteria that you ingest. For example, when you have curd, when you have buttermilk, yogurt, okay, when you have fermented food, fermented pickles, okay, pickled vegetables, you're directly having live bacteria, okay. So that will go and act like prebiotic. It will help your gut microbiome to proliferate more, okay. And symbiotics are a combination of both probiotics and prebiotics that are symbiotics. Some resistant starches, they can also act as symbiotics. Any combination of bacteria, which is bifidobacteria, lactobacillus, lactobacilli and bifidobacteria supplements which are available. Okay. Fermented milks like Yakult, okay, Yakult and all, they come under symbiotics. Yogurt, kefir, okay. Some cheeses are also symbiotic in nature. Not all fermented milks will contain prebiotics. Fermented milk, which is very popular in Korean and Japanese cuisine. Okay, that's an example of symbiotic. You will get that in markets as well. You will see the advertisement of that as well. Yakult. Okay, that's a symbiotic. A Middle Eastern cuisine called kefir, that is also symbiotic in nature. So prebiotics are the food for probiotics, that is your gut microbiome. Asparagus, garlic, banana, wheat bran, flour, flax seeds, whole grains. Probiotics are the good bacteria you have, live bacteria you eat. Yogurt, probiotic milk, fermented milk, sour cream, kefir, any fermented food. In artificial sweeteners, you have different categories. Okay. They have sweet in taste, they're sweeter than sugar. Okay. Colorless and odorless, and it is readily soluble, stable. That is the ideal kind of artificial sweetener. You have natural and synthetic sweeteners. Different categories are available. So there is a low calorie sweeteners called as polyols that are called as sugar alcohols. They have calories, but very low as compared to sugar. So polyols are low calorie sweeteners. Sorbitol, mannitol, maltitol, okay, isomalt. These are the examples of polyols. When you buy any artificial sweeteners, just read the ingredients of it, what it is made up of. You will see all these names behind it. So you will understand, is it a 0 calorie, low calorie, or natural artificial sweetener. Then you have non-caloric sweeteners like aspartame, acyl sulfame K, okay, saccharins, sucralose, stevia. Okay, they don't have any calorie. They have 0 calorie. Aspartame has is been linked with some cancers as well. So aspartame, try to avoid aspartame-based artificial sweetener, but you can go with stevia. It is a sweet herb. It's a natural sweetener. Don't, but these sweeteners, always remember, they are also addictive in nature. Okay, so don't put yourself into the habit of using artificial sweeteners. Use artificial sweeteners to reach your caloric goals, okay, or your weight loss goals. Then it will be a motivation for you to completely cut down the sweet food or sweeteners and sugars from the diet. Okay, so use the Is my screen visible? Am I audible? So stevioside that is present in stevia, that is the chemical that makes it 300 times more sweeter than sucrose. Okay, but any form of artificial sweeteners can be addictive in nature. So make sure when you are on your diet altering journey, it's better to use artificial sweeteners kind like stevia or monk fruit. Okay, but after attaining a certain goal, after attaining a certain weight loss goals, okay, to stay motivated, you can use stevia or monk fruit, and then within 2 3 months try to cut down stevia and monk fruit as well from your diet. Okay, because the main goal here is, if you want to wean the patients away from sweet food, artificial sweeteners are not the solution. Okay, there was an experiment which was done on lab rats. Okay, am I audible now? Am I audible now? So yeah, there was a experiment done on lab rats in which it was seen that two sets of rats were given cocaine, and they were given artificial sweetener as well, cocaine and artificial sweetener. Okay, after certain level, experiments, when the rats were given the option, they went for the artificial sweetener, they didn't go for the cocaine. Okay, so this was not done in human, but it was done in rats, but you can understand how addictive artificial sweeteners can be. Okay, so the main goal of any long-term weight management plan, okay, it's always ideal to make sure your clients or your patients wean themselves away from sweet food, except for naturally sweet food like fruits and all. Okay, it's ideal so that the patients wean themselves away from sweet food. That is the best strategy. Okay, and artificial sweeteners can set like it can give a start to that journey. Okay, and slowly artificial sweeteners also have to be completely cut down from the diet to prevent addictions. Then you have food and drug interactions. every drug have some or the other nutrient interaction. For example, if you are on any medical management, okay, if you're suffering some disease condition and you are on certain drugs, okay, that will interfere with your nutrient, with your food intake at some or the other level. Okay, the action between a drug and the nutrient, and that will not happen when the nutrient or the drug is alone. That is drug nutrient interaction. Okay, a bad chemical reaction that is taking place. Okay. Food drug interaction means it's a it's a very broad term, not just a particular nutrient, but the entire range of food. Okay. Polyols only give you 50% of the energy what sugars can give. They are less sweet and they give only 50% of the energy. That's how polyols contribute to the low calorie sweeteners. So food drug interaction means there could be a drug that has too many side effects that it can affect the overall nutritional status of a person. Okay. There are very few drugs like that. Some examples are given on the tables from page number 223 onwards till 227. So about the new food and drug interactions, you don't have to study it. This is only for the clinical management, which the doctors who are from a clinical background, they will be studying. Okay. Other people, they don't have to study it. They just